This is the Etiology Podcast. I am your host, Elka Kubaku, licensed social worker and psychotherapist. In this podcast, we explore divisive issues around food, health, and body image with the goal of mending relationships within the eating disorder recovery professional community and creating a space where a multiplicity of perspectives can coexist harmoniously. This podcast is uncensored and encompasses the political and ideological spectrum. If you believe something you hear is harmful or misinformed, please be respectful to the speaker. And also, feel free to reach out about recording another episode on the same topic from your vantage point. My hope is that if, as professionals, we can hold each other's stories with respect and compassion, we'll be better able to do so for our clients. In eating disorder treatment, do we focus on managing symptoms or addressing root causes? There are so many issues tied into this question at both a theoretical and very practical level. Treatment focused on symptom management often rests on the premise that the issues encountered in eating disorder recovery are the result, not the cause, of food restriction. From this perspective, when a person is nutritionally rehabilitated and weight restored, many co-occurring symptoms like mood disturbances and body dysmorphia will naturally resolve. In contrast, an approach that emphasizes addressing the underlying root causes sees disordered food behaviors as coping strategies for difficult and painful biopsychosocial events, past or present. From this perspective, sustainable recovery requires that we understand and address these deeper, more complex dynamics. In practice, symptom management often involves allocating food-related decisions to healthy adults, parents, caregivers, or treatment centers until the client demonstrates readiness for increased autonomy. An approach centered around exploring root causes may involve more input from the client, working gradually toward behavioral stability in ways that feel accessible and manageable to them. How much and how deeply do we enter a client's internal subjective experience? What one school of thought sees as essential to recovery, another might view as a distraction. What one sees as respect for a client's right to self-determination, another might view as colluding with the eating disorder. Like most things in recovery, these questions require non-binary thinking. In this episode, Kirsten Honeyball shares how these issues showed up both in her own recovery and in her work with clients. She reflects on the aspects of behavior modification that were necessary and even life-giving, as well as the places where these approaches fell short. Together, we discuss managing risk and safety while also moving beyond mere survival toward holistic health and well-being. We explore somatic treatment, the reality that eating disorders can be subtle and manipulative, and the importance of knowing when to challenge a client versus when to approach with gentleness. Kirsten is a trauma-informed recovery coach, yoga teacher, and wellness facilitator in South Africa. Having lived experience with an eating disorder, she supports individuals and small groups through meaningful personal evolution, particularly but not limited to the space of disordered eating. Kirsten integrates intuitive coaching, embodiment practices, and creative expression to help people reconnect with themselves, move through transition, and lead purpose-driven lives. She also has a podcast called Curious About Recovery, diving into eating disorders. Hi, Kirsten. Thanks so much for coming on today.
It's such a pleasure. It's lovely to be here.
Yeah. Can you start by telling me a little bit about what you do in the eating disorder recovery world?
I work as a recovery coach. I'm also a trauma-sensitive yoga facilitator. So I often incorporate embodied practices in the work that I do with my clients in the scope of coaching. And I'm also trained through the Polyvagal Institute on trauma and addiction from a polyvagal lens. So I incorporate and bring a lot of that kind of narrative into the work that I do. As a coach, I meet with people online mostly, some people in person. And then we kind of cultivate practical tools that can help them through the recovery from the eating disorders. And the main eating disorders that I am currently working with is binge eating, bulimia, and anorexia. And I work outside of the coaching time with my clients in a more kind of casual, informal way where they are able to reach out to me. They are able to connect outside of the coaching times that we meet formally. And in this is just an extra support, someone that can help keep them accountable, maybe someone who can help them through little day-to-day things that get in the way of being able to make choices that feel aligned with their recovery. And then there have been times where I have done more intensive work, where I've been kind of one-on-one with a client in a lived setting. So I've actually been more intensely with that client for 24-hour periods, up to 2-3 weeks at a time, where we're eating a lot together, we're cooking together, we're grocery shopping together. And so there's these practical things that show up in the day of a person who is fearful in their recovery space, that they might just need someone assisting them if that's available to them. Often that is a person who's already gone through treatment, or a person who isn't in a isn't clinically, I'm trying to find the words for this. It doesn't need to be clinically treated in a primary level care. So if a person comes to me and they are maybe not needing to go into treatment, or they've already been through treatment, they have a therapist, they have a team, they have a dietitian, then that's where I'll kind of step in. So yeah, that's pretty much a nutshell of what I do.
Very cool. So you're in the space that you're supporting someone in their day to day
Yeah.
quite a bit, and
Mm.
also doing a lot of somatic, more embodied type of work.
Yeah, absolutely. And I think that that's a really important part of the process, is just to be able to help a person understand how their bodies show up somatically, so that they can befriend those parts of themselves, rather than, I think we speak about, modifying or changing or manipulating, or, um, how do I say, dealing with behaviors and
Yep.
changing things that way. But it really comes down to the relationship one has with oneself, and understanding why that is really challenging for a person to sit with. And now, obviously, I'm not a therapist, I'm not a somatic therapist. So there's things that we don't go into at a level of depth that might be experienced in a therapeutic practice. But there are subtle ways in my trauma sensitive yoga facilitation and my polyvagal informed work that I've done with trauma and addiction that enables me to help people from that lens.
Yeah. So the lens that you're talking about is we're not just looking at behaviors or symptoms or making you eat in whatever way is considered or best meets your body's nutritional needs, but we're looking at what is happening with you and specifically with you and your relationship with yourself.
Yes, yes, absolutely. And I think that that's such an important piece as well, because I've seen so many people, including myself, who have quote unquote fixed the behaviors, in the sense that you've just started acting differently, and nothing about the relationship to those behaviors has shifted. And so, as soon as you aren't monitored by your team or by a treatment facility or something, those behaviors that you now have learned to do differently, while there is a level of need for those behaviors to be shifted, sometimes it falls away and you go back to old behaviors because you don't actually understand why they were there in the first place. So, yes, that is the lens that I work with.
Yes, I've definitely seen that a lot with there are some people who go to treatment centers and you'll see they move through it and are doing pretty well at the end. And then I've definitely seen people who go to a treatment center, come back home, slip right back, go to another treatment center, and it just becomes almost this repetitive cycle. Can you tell me, as much as you feel comfortable sharing, what that was for you?
Yeah, yeah, absolutely. And I first want to just put a disclaimer out there that this is not in any way to like bash the treatment process. And I think that there's necessity at every stage. And it's really important to know that each person is completely individual. So someone is going to respond to a treatment facility first time, and really that like really waxes it's really waxed for them, and they are able to move through that, and other people don't, and it's really case dependent. So in terms of my own experience, I admitted myself to a treatment center when I was 22, 23, and that was because I was chronically bulimic. I was just like really, really stuck in a very dark space. So sometimes it'll be 16, 24 hours consistently binging and purging, which was a really dark space for me to be. And I was anorexic, but in my mind, I was fine. I didn't think that I needed to gain any weight, and I couldn't really see what was going on. At the time, I was also quite heavily into like the party scene. So, really just self sabotaging behaviors all the time. And I went into treatment just realizing that I can't do this on my own. Like something needs to get in the way of me and myself. And I
Yeah.
saw incredible value in that. I don't think that I could have believed that I could stop my behaviors if someone hadn't literally held my hand through that. Um, However, when I left treatment, there it felt sad for me at the time because it felt like there was nowhere for me to land. So I didn't get given anything that would help me outside of when I was actually out of the treatment center. So I went straight back into life, really not knowing how to do any of the stuff that they taught me when I was there, or less so that they taught me, but more so that they told me to do. So I didn't really feel that I got the ability to employ my agency and to be able to say, this is how I show up to do this thing for myself when someone isn't telling me to do it. And unfortunately, with a whole bunch of other life events, I was able to kind of feed myself and show up for myself for a short period of time. But as soon as life chaos happened, and at the time it was actually my parents getting divorced as soon as like 2 months after I came out of treatment, I didn't actually know how to handle that. So immediately my behaviors became my coping mechanism again. And
Wow.
it really was through taking things a kind of different route. So I then went into 12-step programs. And really there what I learned was how to thoroughly self-examine my mind, my body, my thinking, my spirit. I was really challenged to see myself in many, many different ways and to really think about that critically. Um, so that, and then I had community support as well, which is really great. And those kind of two things were very, very helpful for me establishing some kind of groundwork and foundation for my sustainable recovery long term. But it was only through embodied practices where I actually started to learn how to be in relationship to my body and my feelings and my environment and my the peers and people relationships. It was only through that that I really felt that I wasn't slipping back again and again. So I could understand my thoughts, I could understand my behaviors, I could understand my body's nutritional needs, I could understand all of these, but until such a point that I really understood the relationship I had with my body, I didn't see anything lasting for a significant amount of time. So I hope that answers your question.
Yes, there's so much there, and I want to zoom in on each part of that because there's
Mhm.
so you go to a treatment center, very behavior focused. It
Mhm.
sounds like maybe to some extent a more, I don't know if coercive is the word, uh,
Mhm.
but sort of authoritative environment where, which is
Yeah.
often the case in higher levels of care, where it's just like we need to get used to stability and this is what you're going to do to get there.
Yeah.
Then you move to 12 step, which is a whole nother topic that I'm really interested
Mhm.
in. And
Yeah.
it helped you look at yourself more. And then when you move to the embodied practices, that's what really started to shift your relationship with your body.
Yeah. Yeah, absolutely. It's interesting you say about that kind of authoritarian perspective. And the way I explain it to my clients a lot of the time when they've had similar experiences with treatment is I say, if you have a gunshot wound and you go into the ER, none of those nurses are asking you how your day was or whether you feel okay. They're just going, let's like stabilize this person. Gunshot wound, here's the injections you need, here's the stitching you need, here's the surgery you need. And that's kind of how I see higher levels of care, is it's very much focused on how do we just make sure that this person doesn't die. And I think that that sometimes feels a bit blurry because as we are complex human beings, we need to make sure we don't die, but we also need to see our spirits and our souls and our minds and our emotions and all of those things at the same time. We can't separate those things. And I think the moment that we try to separate those things in recovery from eating disorder, we really lose the bigger picture of what it means to be a human being. And so while, I remember going into my treatment center, and at the time I didn't feel safe to eat at all. And there was one person who happened to be a male who was the only person that I really felt like if he was sitting at the table, I could eat my meal and I could finish it. And I don't know why that was, whether it was validation or codependency, but all I knew is that that person I felt safe with. And I immediately got criticized as trying to be romantically interested in this person. And we were put on a no contact ban. We weren't allowed to be in the same room. We weren't allowed to be in the same groups. We weren't allowed to talk to each other. We weren't allowed to eat to each other with each other. And this really distressed me because I was like, here I've come to a place where all I'm trying to do is feel safe in healing myself. And I'm being told I'm not allowed to do that. And I didn't really at the time need to understand why that was a safe space for me. Now, you know, I can understand from a therapeutic kind of point of view, maybe there was a male figure missing in my past and I felt safe with another male. Maybe I needed the validation sexually. Who gave a shit? Sorry, I'm swearing. Who
Totally.
cares?
Yeah.
But yeah, so I think it's really just how do we understand the whole human in the process of healing from an eating disorder rather than only seeing parts like behavior. But it doesn't negate the importance of looking at the behavior and the changes of behavior. So it
Yeah.
doesn't make sense. I know you
Yes.
didn't really ask a question. I just went off on a tangent there.
Um, no, totally keep talking. This is just a conversation.
Mm.
So on the one side, you're like, okay, I was in crisis and I needed medical stabilization, so that was needed. And on the other side, you're like, there were parts of me there that I had brought into treatment that could have been seen more. Like this guy who made me feel safe. Like if somebody would have just taken the time to understand what was going on for me, or maybe responded in a way that was less harsh.
Yeah, absolutely. And I think, for instance, if someone had taken the time to understand why that was presenting itself, it might have arisen instead of being punished because my eating disorder punished me enough for many, many years. And that was the narrative I was used to. So I'm like, okay, well, I'm doing this thing now and I'm just being punished anyway. Anyway, backtracking to the answer I was going to say to you is if I had been held or seen in the way that I needed to, it might have been established. Oh, wait, there's a sense of safety that this person brings to you. So, how are other ways that we can help you feel safe while you eat? Rather than just being like, you're trying to be sexually attracted to this person, therefore you're bad and wrong, and you need to now be taken away from this. You know what I mean? Like, so yes, absolutely. And I think something that people with eating disorders struggle with so much is not being seen, not being fully embraced, validated. And so yes, if there had been a space that had allowed to see me and not just what I was doing, but rather getting to that root, it might have felt like, I mean, it was, I think, 5 years before I actually got recovery after that treatment stint. That's a long time to try
Yeah.
be working for recovery and not seeing any success.
Yeah. And you had admitted yourself, so there was some degree of receptivity there
Yeah,
that could have
absolutely.
been tapped into more.
Yeah, absolutely. I think there was a lot of shaming as well, a lot of shaming for behavior, which was, anyway, I know we're all going off on a tangent now. But yeah.
It does all tie together because in higher levels of care, because like you're describing, it's that emergency care, oftentimes what happens is there is perhaps some degree of, I don't like the word coercion, there's got to be a better word for it, but
Mm.
there is some degree of behavior modification, if you will, that's
Yeah.
required just to keep people alive. And what then winds up happening is the environment that is created can become very rigid,
Mm.
and the rest of the person or maybe behaviors that are not life threatening and are more complicated almost get lumped into that attitude of this person is not able to take care of themselves and we're responsible for just making them, which like you said feels like such a shutting down of self.
Yeah. 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 Absolutely. And I think, again, this is not to bash on very, very critical things that are needed in the recovery space, which is higher levels of care. And that's, I don't necessarily think that this conversation goes into like saying what's wrong with those spaces. It's more going what could be added.
Yes.
So for instance, with the idea of, and I'm losing my train of thought now. Could you repeat what you just said back again so I can just refresh that in my mind?
I was saying how because sometimes behavior modification is so urgent in higher levels of care and so life-giving and life-dependent, other behaviors that maybe aren't exactly linked to that can become lumped into what becomes a more rigid environment. So in a higher level of care where it's just like we need to get this person to eat or to stop self-induced vomiting at the very least for the time they're here. And then that becomes this attitude of this person isn't capable of caring for themselves and this overriding what in your case was somebody who helped you feel safe, where there was such like there was some kind of emotional reality underneath that. And that wasn't
Yeah.
an immediate life-threatening behavior, but it gets lumped into this perspective of we have to almost manage this person.
Yeah, absolutely. And I think that that's, you know, it's not that those things aren't exactly or aren't critically needed. I mean, yes, we do need to make sure that this person is getting adequately nourished and this person is not having self-induced vomiting. Like we need these, and there's we're not putting that aside. We're just going,
Right.
we need these and something. Um,
Mhm.
And this also brings in like the topic, I know in a therapeutic practice, a lot of the time to help a person with black and white thinking, we're actually incorporating the word of and. How do we help a person be in paradox? How do we help a person be in complexity? How do we help a person be in complexity? Um, how do we help a person understand that rigidity is partially some of the things that got us there in the first place? I mean, a lot of the time I'll see people coming into recovery and being like, I have to eat it at exactly 12 o'clock. And if it's 1 minute before and 1 minute after, then I'm relapsing or something like that. And it's like, okay, we're pathologizing a lot of human behavior, a lot of real. And I always say that, like, there are schools of thought that pathologize things that are really normal to experience. And if we cannot say that this person is bad for experiencing something, but rather let's understand why that experience is happening, why it's presenting itself. And a lot of the time it will come into the topic of trauma and safety and the need to be able to be in complexity and away from black and white and with the body in a way that feels, safe, pretty much.
Yeah. I love what you're saying about this and that we might need that crisis management and we can add more to that. And what you're tapping into also is, and I think most people would agree on this the importance of this, whether regardless of theoretical orientation, whether you're in family-based treatment or behavior modification, CBT or somatic practices, that we need some transition from higher
Mm,
levels of care to what comes afterwards.
yeah.
And the way that this plays out in, let's say, family-based treatment, which is a much more behavior focused, is that we move from stronger or more, let's say, parents or caregivers initially have total responsibility for what the child is eating, and they begin to give the child back some power or some control after they've reached certain milestones. But what we have with higher levels of care oftentimes is like you're describing, where you're in this very controlled, in some ways very rigid environment and are just kind of thrown back into life without having something to bridge the gap.
Yeah, yeah. Well, I think that this is where recovery coaches can become really valuable in the sense that, you know, I don't know fully or understand fully because I've never studied it and I'm not a psychotherapist, but the kind of process of the FBT, but I do understand that it goes from our choice, like parents taking that choice and then kind of gently. And what I really hear in that, and I could be completely off the mark here, what I really hear is like either someone's doing it for you or you're doing it on your own. And I go like, well, where's the in between of that? Where's the here's how you do this on your own, and these are how kind of like this is how you relate to being able to make your own choices. And I'm sure that that's probably discussed in like if a person is in that kind of therapeutic modality. But
Yeah.
maybe it's speaking into something bigger in that, like, okay, I'm in a treatment center and I'm doing this for you. You know, the meals are
Mm,
being plated, or maybe you're being told this is what you eat. And then you're going out into the real world and you're going, okay, now it's all on me, you know? Um,
mm,
and so I guess where things like coaches or people that work with the body in terms of understanding the relationship to the body can actually help that person create or cultivate a sense of agency within themselves so that they are increasing their interoceptive awareness, so that they are able to access emotions in a safe way. And then see how that plays out in relationship to their food choices or their body choices or their food thoughts and their body thoughts. So again, I'm going off on a tangent, but
There's no
maybe you've got
tangents. It's
something from
just a
that.
conversation.
Yeah.
What I hear you saying is that one piece of it is this transition, not just jumping from highly
Yeah.
controlled to lack of control. The other piece is what's allowing you to make that transition and
Mm.
going to some of the deeper things that give a person the tools to relate to their body in a different way, not just to change
Yeah.
behaviors, but to shift their relationship with their body. And the self abandonment is a word that somebody else who recently came on here used that I think captures a lot of it as well. But to be able to start to shift their relationship so that they can connect to their body. And when some of the external structures maybe are starting to fall away, they have almost an internal guidance that they can depend on.
Yeah. Yeah. And I guess the question arises is how do we effectively guide or teach or create that space for a person? A lot of the time it is through somatic practices, it is through
Mhm.
embodied practices. Those kinds of things can be really helpful. But I guess it's the question on a lot of people's mind is like, how do we actually create that for someone? You know, so that they are going away with, because this kind of relationship with the body, it's a very personal thing. It's not something someone else can do for you, but it is something that you can be taught to connect with in a gentle way. And if a person has trauma, it can be a lot harder for them. If a person has neurodivergence, it can be a lot harder for them to be able to safely explore the body in a way that is relatable. And
Yeah.
if there is an environment that they're going back into that still exacerbates the traumas that formed the eating disorder, or like not formed, but contributed to the severity of the eating disorder in the past, like how do we help a person feel safe when they're still experiencing all the things that were there in the first place? And I see this a lot in, okay, not specifically eating disorders, but my supervisor, she works a lot with trauma in rural communities in South Africa. And here we're going, let's help people feel safe within their bodies from a somatic perspective. And then we say, okay, cool, but now you're going into a highly, highly violent, poverty-stricken home where your uncle is, abusing you, and you don't have a mother, and like these kinds of things. So like, it's not as simple as just how do we help a person relate to their body. It's how do we help a person relate to everything, and how do we help them relate to that when there's nothing that they can do about it, or nothing that they can change or control, or so I think
It's much
we
more holistic, yeah.
yes, yes, and that's why I genuinely think that a holistic approach to eating disorder recovery is the only way to deal with eating disorder, and that's just my very strong opinion.
Sure. Yeah.
Yeah.
It's your very strong opinion and also what you've seen and experienced.
Yeah.
What you're
Yeah.
describing with the environmental piece is it's so difficult, and I've encountered this as well, not even in eating disorder recovery necessarily, but also in trauma recovery like you're talking about, where getting in touch with some of the softer or this almost the safety mechanisms within a person while they're still actively threatening feels pretty tricky because they still need a lot of the walls that they put up for survival.
Yeah, yeah, absolutely. I mean, I've worked or interacted with people on a peer-to-peer perspective who are in war zones and struggling with eating disorders, and
Wow.
going like, well, this is the only place I feel safe. And you kind of go like, well, yeah, of course. Like how do you tell a person that that's not a safer space to be,
Wow.
and
Can you
so,
talk about that work?
yeah, do you mind if I just get my laptop charger quickly?
Sure, go ahead.
So sorry, 1 second.
No problem.
Okay, yeah, so I'd be happy to answer some questions, provided that I'm just staying with the respect of anonymity with this person and their story
Sure.
and all of that. So, if you have any specific questions, I'd love to see if it's available for me to answer.
For sure, that makes sense. I'm just thinking, and maybe you can like tie together or sort of pull some more general
Yeah.
experience. Yeah, I'm thinking about again what to ask that preserves anonymity or doesn't go into too much specific. But tell me a little bit about the type of work that you're doing with somebody who's in an actively unstable environment
Yeah.
and
So,
behaviors have a very clear present function as well.
yeah, yeah. So, I mean, I've mentioned this person that was in the war zone, and I have currently a client who is in an abusive household. And so understanding that, like, this person showing up as best they can to, eat a meal, and yet still feeling like it's holding on to safety. And, the only thing that I can really say that I can offer that person is micro moments of what it feels like to feel safe with another person. Just showing them that it is possible, that it's not their abusive environment or their war zone or whatever's going on for them, whether it's really hectic trauma or experience, or whether it's just something that's perceived, because there's a lot of people who have, if you want to call it, much milder experiences, but are still as valid to them. So I guess the way that I work with or show up with those people is just really being like, the the trauma that you're experiencing in your environment isn't the only thing that exists. And I even get emotional as I say this, because there's been times where I've sat and I've been in meal support with a client and I'm in tears and they're in tears. And all we're doing is like, it's just okay for this moment just to be here with this meal, you know,
What a
and just
powerful.
really holding that. Yeah, yeah. And I think it takes a lot of courage for any individuals that are working with eating disorders, but it's even more so for those people who really understand how critical it is to create a container. And a container doesn't mean that there's nothing outside the container. It just means that in that container there is safety.
Yeah.
Um, so a lot of the time I really slow things down. Um, Sometimes if a client needs to stand up and do a few stretches, or maybe needs to focus on some breath, or maybe there's times where the client needs to cut up the food into tiny little pieces and put it on a separate plate and take one by one, because that's all that's accessible for them at that moment. And yet they're told, yeah, if you do that, that's eating disorder behavior. And I'm going, yeah, but we also need to help a person get to a point where they feel safe enough to not do that anymore, which means they might need to do it at first. And that's controversial because not a lot of people would align with that way of being. But in my experience of sitting with people through meals specifically, it's the way that I've actually seen progress. Is when I can say, how are you presenting right now? What feels safe enough for you? And let's meet you there. Um, and again, this isn't necessarily for someone who is in such a critical stage that might need to be tube fed or something like that. But it's just these micro moments of a person going, oh, wait, this is not the only reality. There's an opportunity to do and see things differently.
Yeah, you're giving them a little window into safety.
Yeah.
The phrase that's coming to mind that I've heard from actually the Hearing Voices Network and Compassion for Voices, which a little bit of a different area, but being with rather than doing to.
Oh, that's beautiful. That's beautiful.
Yeah, and the
I,
statement that I hear you saying is, I don't need to fix you right now. Like what you're
yeah.
dealing with and what you're going through is hard, and I'm here with you.
Yeah. Yeah. Yeah, absolutely. And I love the word with as well, because, a lot of the time when like a client will reach out when they're having an urge to act out. And I often speak to them about sitting with the urge. And they go like, "Oh, what does that mean? What does it seem? That sounds like terrible. I don't want to sit with an urge. That's like torture." And I invite them to just imagine if the urge was just sitting next to them like a person, and they could have a conversation with that urge, and they could, so it's not like consuming them, but it is allowing them to see that it isn't all, that it isn't them, if that makes sense. And a
There's a
lot of the
little
time, it's the same. Yeah, there's a little bit of space, and a lot of the time with like emotions, or can we just sit with this meal? There's been times where I'm in a meal support with someone, and all we do is sit and pick the thing up, put it down, pick it up again, put it down. Like we're not sometimes not even engaging with the meal because that's not where they're at yet. Obviously, a lot of schools of thought will be like, that's not enough. And I'm like, well, isn't that what the eating disorder tells you? That's not enough. It's not good enough. It's not good enough. Um, so I don't know. I think I have, from my personal experience, when I got out of treatment, where it was very much like do as we tell you to do, it felt like an unsafe space for me to be. And from there, I actually didn't have therapy, and I didn't have a dietitian, and that's not ideal. It's not ideal to not be guided, and it's probably why it took me so long as well. But what I did was I sat with myself in the way that I knew how to sit, so that it was enough. And that started with smaller meals than I was supposed to have. And it started with things that I felt safe with, that I gently challenged over time. Um,
yeah.
and again, like I say, not necessarily ideal, but that's the resources that I had at the time. So yeah.
Yeah. And also, I'm I'm debating internally to what extent I should tie this into different theoretical modes of thought, and which
Mm.
I'm going to actually set that aside for now just because I want to hear more of your story. But there's so much in the therapy world that can explain your process as well.
Mm.
And so much in even, let's say, in the exposure process that recognizes and acknowledges that there are things that might not be touchable at first. And if we
Yeah.
can only just get our foot in the door or just touch something that feels accessible with
Mm.
your agreement, not that I'm making you do this, but with your agreement, like the exposure process, which is one of the like sounding almost more harsh approaches or more behavioral,
Mm.
there's always permission from the person beforehand, which sometimes in crisis we aren't able to do. But like you said, there's that space between that maybe this behavior isn't going to kill you. And we can cut up those pieces of food really small and be with what's accessible right now. Can you
Yeah.
speak to your process of discovering what was underneath it and some of the somatic work and what that was like for you?
Yeah. Just before I go there, I just want to highlight the very real concept of eating disorder, bargaining, and manipulation for oneself. Am I allowed to say? Can I
Go for it.
say a swear word?
Yes. Say
Okay. So
whatever you want.
so
There's no monitoring here.
so I always say to my clients, you can't bullshit a bullshitter, right? Because I literally could bullshit myself into thinking anything to twist the eating disorder narrative. And so I would hear, oh, let me meet myself where I'm at. And I would hear, oh, that means I can restrict, Oh, that means I can, you know, purge as many times as I want to today because that's just where I'm at. And yeah, there's some truth in that. But I just want to like acknowledge the fact that it's very tricky to know where are we meeting you where you're at and where are you actually enabling the eating disorder. And that's like thinking at the edge, sitting at your edge, kind of window of tolerance stuff, but it also is like rigorous self-honesty, which is really hard for a person in an eating disorder. But what I have witnessed is that it's much easier for a client to be rigorously honest if they really believe that they're safe with that person. So I've had clients who've come to me and be like, I flat out lied to you about the fact that I acted out. And I'm like, okay, cool, let's deal with that. So I guess what I wanted to point out there is that it's a really tricky space to be like finding the in between of do this because that's what's required. And if you, I mean, I even have clients who, for them, act. Let me backtrack a little bit as well. There is also a stage of my recovery where I had zero tolerance with myself, as in like I had literally called it the nope policy. So something would come into my head and I would say, nope, nope. I would want to act out. I would want to restrict. I would want to take one spoon less of something. I would want to, change that food to a different time or whatever. And I was just, nope, nope, nope. So there was some level of needing that, like, this is what your baseline non-negotiables for recovery are. And if you're not meeting yourself there, then you're actually letting the eating disorder make the decisions. But that also can be a very personal experience. That can be something that is different for everyone. So a lot of the time when I'm working with clients, we form a baseline of non-negotiables. Okay, these are your non-negotiables. If you're not meeting those, self-defined, then like that is 100% the eating disorder taking charge there. Anyway, I diverted and I forgot your question. Please. I'm so sorry.
I'm so glad you brought that up, though, because that is one of the very valid concerns of people who are hesitant to adopt, let's say, a harm reduction approach, is because, like you described, eating disorders, and this is true of a lot of different compulsive behaviors, often do go along with a type of deception and self-manipulation.
Yeah.
And so it does become a really tricky space. And that's the question that's often asked with softer approaches is, are you enabling the eating disorder?
Mm. But I think that that's, as a practitioner, I think it's our responsibility to be able to understand when to soften and when to be firm. I mean, it's like a lot of the time people with eating disorders are missing that parental role, and so you'll a lot of the time have therapeutic practices where it's reparenting yourself and those kinds of things. And what does a parent need to be? A parent needs to be able to know when to say, it's okay, let's be gentle, and when to say, actually, you're bullshitting yourself and we need to get like a little bit real here. And
Yeah.
that being, yeah, go for it.
Oh, I was just going to say, I've seen working with adolescents as well when I was in that space, people who really appreciated that when, like you described, there was a solid therapeutic relationship or a solid alliance, really
Mm.
appreciated being called out and like
Yeah,
just telling me what I'm doing for what it is.
yeah, yeah, absolutely. And I think like that's, like I said, I think that's, as professionals, our responsibility is to cultivate that skill. And I think that if anyone is listening to this and they are a practitioner or clinician or something, and they feel like, I don't know how to do that quite, like challenge yourself to cultivate that skill. Because we do need boundaries, but we also need a hell of a lot of compassion and softness. And if we're only on one end of the spectrum, we're never going to really fully support that person. But also going on to, I can't remember what I was going to say now. I forgot. If it comes back up, I'll mention it. Oh yeah, I think I was. So I wanted to just pay attention or mention this thing of the what is the function of the eating disorder or the behavior. Again, acknowledging things like neurodivergence, um, because sometimes that can present itself differently. Um, but you asked me like what was the process of kind of getting to that space for myself, um, understanding, relating somatically. It's been one hell of a process, I must say. And I've met myself at different stages along the way. And some of it has brought me to my knees, and some of it has made me really have to humble myself into like how powerful the mind and the body can be. And then other times it's been like a beautiful, flowing, gentle dance of, sunshine and rainbows.
Totally.
So I guess understanding for me, cognitive understanding of my attachment can be really helpful. Understanding, why am I holding on to this thing, and what is the function of holding on to this thing? What is it bringing me? And that has been through things like, what is this food bringing me? What is this relationship bringing me? What is this behavior that's not eating disordered bringing me? So really just understanding that and why I've believed I've needed that. And then working with embodied practices, I was even doing a meditation this morning where I was going into my mind space, and I was breathing in, breathing out, acknowledging that, and just repeating the phrase that my only responsibility is to stay present. That is the only thing that I need to be able to really master. And so I guess my journey has been how to really master a state of presence. And that requires me to really sit with myself. It requires me to, I often say to people, like a phrase of my, or mantra of my recovery is make stillness a priority. So if something's going on, something's chaotic, slow it down. Make stillness enough so that I can hear, okay, what is this really about? What's underneath that? And I'm fortunate enough to have training from a psychological perspective, that I understand certain things. I think psychoeducation is incredibly valuable. And then I've also had the ability to feel safe with practitioners, with coaches, with sponsors, with communities, with people that have made it feel safe enough for me to question myself. And so I guess cultivating a sense of curiosity and non-attachment has been a really big part of learning how to show up for my body and be okay when that's an imperfect presentation, if that makes sense. I'm
Yeah.
hoping that answered sort of your question. There's probably more specifics along the way, but I could like dive into them with further questioning.
Yeah. I'd love to hear more. I know you have to go. And
So,
yeah.
I actually I have a meal support, and my client said that she could meet me at 6. So I'm happy to stay on for a little bit more if you want to still
Amazing.
talk. But yeah, cool.
Yeah, that would be awesome. So part of it was this cognitive understanding of what's the function of this behavior. And the other part is more of a being, like we described before, being with, but creating enough quiet to let whatever was underneath it to surface on its own.
Mm, mm,
Can you share some of what came up for you around
yeah.
both what was the function of this behavior and some of what you learned about yourself in this process?
Yeah, so as I mentioned, like understanding my attachment was really helpful from a cognitive understanding perspective. Understanding why, because of my parental roles, how they showed up and how they presented, understanding why certain needs weren't met when I was younger, understanding my family dynamic as to why certain things weren't addressed, why certain things weren't held, why things felt that they were unsafe. Also, my struggle with identity in terms of really harsh bullying, abusive sexual trauma, like those kinds of things, understanding that it really just became very foreign for me to feel like my body was a safe space to be, because it was either, and just disclaimer, my parental relationships have immensely healed, which I'm very grateful for. But understanding that my father's emotional absence made me feel like my emotions weren't if you want to call it valid or important. So there was this deep feeling of I'm unimportant. And then going to school and being severely, severely bullied. Then being shown by my peers that I'm not wanted, I'm not accepted. And then going into relationships and going into environments where I was sexually abused, being, oh, my body's not a safe place to be. So this kind of complex, if you want to call it, cocktail of things that spun the narrative of I'm not okay, or not I'm not okay, of I don't matter, I'm not important. And that was a big, big narrative for me. And I always felt like I didn't have a space that I felt really grounded in, like, okay, it's safe to be here. Even though I recognize that my traumas and my past weren't anything compared to a lot of what I've heard or seen or witnessed. But then from a body-based perspective, what I found I was very disconnected from was the ability to feel an emotion as it presented itself physically. So like when I feel happy, how does that feel in my body? Like what are the sensations? Where is that in my body? Like what happens if I move differently when I feel that feeling or when I don't feel that feeling? And really exploring that space. And what I did find was a deep sense of like a gaping hole in my chest. And I often speak about it like it's almost the way I describe it is it's like someone scooped something out of my chest area. And funnily enough, it's actually not the first time I've actually heard this. It was actually reflected back to me by clients like, oh, there's a gaping hole, there's a void, there's something missing inside that space. And so I would really connect with that feeling of, oh, wow, that feels like a huge hole. It feels like a void. It feels like missingness. It feels like a lack of home. And that sensation came up in a, I can't really describe it, but sometimes I felt like it was knives or like a slice or cutting into my chest. And it often felt quite achy. And so what I would start to recognize is I'd have an urge to purge a meal. And before I would act on that urge, I would go, okay, I would stop. I would stop in my kitchen or wherever I was, and I'd stop and I'd go, where is this urge in my body? And I often would connect to that gaping hole in my chest. And then I would say, okay, what does this part need right now? And a lot of the time it was like I would get angry at that question. Like I was very frustrated because the idea of asking myself, what does this part of my body need, seemed so airy fairy and so like not concrete that it would frustrate me to ask the question. But when I would ask the question, a lot of the time it was simply bringing my hand to my chest and being with myself in like a way that felt safe. Like, okay, this is okay. It's okay to feel this feeling. It doesn't need to be fixed. It doesn't need to be changed. It's just here. I'm just noticing it. I'm witnessing it. And so witnessing the sensations and really slowing down enough to feel them, then and I'm saying this like it was an overnight process. This is years of work. This is years of learning how to communicate with my body. And now when I'm able to give myself compassion, love, joy, if I check in with that space, it feels like it's been filled with like yellow putty. I don't know how to explain that, but it's like a swirling yellow glowing putty that feels like it's in that space. And as soon as I connect to that feeling of the void, like I can understand that something is off in my life. And I've felt that same void feeling in relationships. And I've felt that same void feeling in the work that I do or in my sense of purpose. Or, so I've seen how, okay, this voidy kind of empty, whole, scoopy feeling that I've got in my chest, the food or the food behavior was just one way of filling that instead of putting the yellow putty there, you know.
Yeah.
And that open gaping feeling presents itself in every single area of my life. It's not just with the food. So, yeah, I guess I could probably go on about this for ages, but that's kind of what comes to
Yeah,
mind.
and I can listen for ages. I had a moment when I started to tear up a little bit when you were talking about that gaping void because that rings so true to me, and I've described it in almost the exact same words, and I had such a similar experience with when I was binge eating and started to learn in some way similar to what you're describing, but to just stay with it, and that, like, yeah, that just
Mm.
gaping void, or for me, it was a burning in my chest.
Mm. Yeah, thank you so much for sharing that. That's so, that's like, I know this sounds weird, but it's really nice to hear that was relatable because it also validates my experience. And I'm sure it validates a lot of people's experience. Something that
Yeah,
comes up for me that has been a really big theme in my life is that void is often um, not having the answer to the question that is, what is there, what is left when all there is me, you know? And for a very long time, the answer to that was deep, longing, painful loneliness. Like, really just feeling like a sense of loneliness that cannot be filled with anything except maybe the eating disorder or a person, you know?
mm,
And so, really taking the eating disorder behavior away and really learning that that was the feeling that was there was like, oh, flip, the eating disorder just solves this feeling. And if I can actually learn what this feeling is about, like, why do I feel so deeply lonely, even when I'm surrounded by people? What is that saying about me? There's moments where I had sort of answers and moments where I didn't have any answers at all. And it's still a theme that sometimes, like, there are moments in my day where I'm like, wow, there's a deep loneliness there, and I'm not quite sure what that's about. And it's okay that I sometimes don't know what it's about because I can still show up respecting myself and nurturing myself. And it's through those practices that I've learned to actually really care for myself through those feelings that I'm then like, okay, this softens and it eases and it's manageable to hold this feeling. And I'm sure that I will understand it on many different levels in many different ways for the rest of my life. Because we're always understanding ourselves on deeper levels. So
yeah. We can hold the void instead of having to get rid of it or having to make it go away.
absolutely, absolutely.
Yeah,
I guess that this is another thing I speak about is like, when you have had a life of eating disorder or any other addictive, if you want to call it that, or adaptive behavior, um, is that we do learn that when I have a feeling, I can change it. And so coming into recovery, going, well, I have this feeling and I can't change it, or I'm choosing not to change it, that is incredibly uncomfortable. It's unbearable, actually, to have something that we're so used to being able to do and now going, well, you can't do that. And then it's like overwhelming, which then I understand why then people go back to the eating disorder behavior because it's like, well, this thing works, you know,
yeah.
works really well.
Fair. Yeah. It's so amazing for me to hear your story because, and this is what I'm part of my goal in this podcast is to get to what's underneath it. And it also is part of what you're describing, where we see just a behavior, or we see just a position or a perspective. And when we
Mm.
start to share more personally, or to, in the case of working with clients, we're not maybe sharing less of that with them, but giving them space to share what it is for them, like, we discover there's just this whole massive and complicated and beautiful world underneath it all.
Yeah. Yeah. I think the biggest thing for me at the moment is really just teaching people that messy is okay, you know,
Yeah.
um, and like and really holding that. I mean, like really, really holding it, like the kind of holding that that you crave when you're feeling lonely. It's like something fully like there is nothing more than I would want in my life to be entirely, fully embraced and held and loved by someone. Like that
Yeah.
is a deep, deep need. And I think of most humans.
Yeah.
And that means like if I'm really emotional or if I'm really like angry or whatever, that I can be held no matter what. Unconditional love. And so I think that like creating spaces where we can allow people to be as messy as they need to be while also going, you don't have to stay in the mess. The mess doesn't have to consume you.
Yeah.
I think that that's a really important part of the process. I think I had a point there, but I'm not sure what it was.
Yeah. We can stand outside the mess and
Yeah,
let it be, and also let it merge and shift and become something else.
yeah, absolutely.
Yeah. Thank you so much, Kirsten.
It is such a pleasure. Thank you.